Hello,
Go.
good day everyone. I hope everything is doing well with you today. I am Daxx Bugtai,
I am Ira Faith E. Bruno
and we're going to report.
about tuberculosis.
So let's see. So, unsa man jud ang tuberculosis? Di ba ang atong hunahuna kay ubo, sipon, maglisod ginhawa. So ang tuberculosis, ing ato jud na siya, and it is caused by a bacterium called Mycobacterium tuberculosis. And the bacteria usually attack the lungs. Mao jud na ang atong hunahuna kana permente i-attack ang lungs and or lungs ra jud ang atakihon. Mao jud na ang nasa hunahuna. Pero wala ta kabalo nga ang TB bacteria kay it can also attack any part of the body such as kidney, spine, and brain if not treated properly or kanang napasagdaan lang. And ang TB bacteria is spread through the air from one person to another, usually attack the lungs as I have said. So kini siya kay isa ni siya ka airborne disease. And also TB disease can be fatal if not treated properly, Jude. Okay, so next. And in healthy people, infection with Mycobacterium tuberculosis often causes no symptoms since the person's immune system acts to wall off the bacteria. Okay, so natin ginatawag nga active and inactive TB. So ang inactive TB kay mostly it is because nga mas kusog ang immune system nga gi-attack niya sa isa ka tao para sa nang healthy people. So mo fight back jud ang body niya sa bacteria. And this comes nga kana ang inactive TB kay wala siya symptoms nga maipakita sa isa ka person pero infected gyapon siya. And if you have the active TB, the symptoms of active TB of the lung are coughing, sometimes with sputum or blood. Pero unsa man yung sputum? Nganong kuan man? So ang sputum kay mo po na siya ang tawag nga phlegm or ang phlegma nato. And what is the difference between sputum and saliva? Ang saliva gikan sa mouth, while ang sputum is ang gooey substance nga gikan jud sa ato ang lungs. Then next symptom is chest pains, weakness, weight loss, fever, and night sweats.
Okay, so ang Mycobacterium tuberculosis has an unusual waxy coating on its cell surface. So makita natin sa picture diri as a right side na ang itsura sa tuberculosis kay waxy coating siya ang iyang cell. And in order for us na makita nato unsa ang TB sa under the microscope, we can use the Ziehl-Neelsen stain or acid-fast stain is used. So unsa man na siyang Ziehl-Neelsen stain? Muna siya ang type of differential bacteriological stain used para makita nato and ma-identify nato ang acid-fast organism sa or tawag nato na tuberculosis or M tuberculosis. And this organism is highly aerobic, which means kung highly aerobic siya, so ang bacteria na thrive siya grow in aerobic environment. So ang humans are also only known as a receiver of M tuberculosis. Pero na instances na ang animal na mga instances ang animal magka-tuberculosis pero mostly gid ang only known to receive lang gid ang tuberculosis kay ang humans. And its cell wall prevents the fusion of the phagosome with the lysosome, which contains a host of antimicrobial factors. Okay, next. So, in preventing and pag-control nato sa spread sa tuberculosis, it is important to detect the cases and treat them accordingly. So in order for us to detect, we have the case finding, which defines as the identification and diagnosis of TB cases among individuals with signs and symptoms presumptive of tuberculosis. And ang atong approach aning case finding para makabaluta what is sa atong kung nabatay sakit na tuberculosis it includes passive and intensified case finding. And there are available tests utilized by the program, which are direct sputum smear microscopy, TB culture, and drug suspectability test, tuberculin skin test, and rapid molecular diagnostic test. Later on, ma-define nato and mabalaan nato unsay definition aning mga available tests na i-utilize sa tuberculosis. And by the way, a rapid molecular diagnostic test muna siya collection of techniques used to analyze the biological markers sa TB. Okay, next.
Okay, so ang first na to nga test to perform in case finding is the direct sputum smear microscopy or DSSM. Okay, so what is DSSM? So it is a fundamental to the detection of infectious cases and recommended for case finding among adults and children who can expectorate or kanang pwede siya ma-expectate or ma-obserbaran. And it is the primary diagnostic method adopted by the NTP among such individuals because, pero wait, take note, what is NTP? Ang NTP is the National TB Control Program. I-take note na ninyo ha. And so, let's proceed. Number one, it provides a definitive diagnosis of active TB. The procedure is simple. Number three, it is economical. And number four is a microscopy center could be put up even in remote areas. So ang direct sputum smear microscopy is kana magkuha kag sample nga sputum from the patient and then ibutang na siya sa smear. Kabalo naman ta kung sa na smear no kanang ibutang siya sa slide. Then physically then nga i-observe from the microscope, and that is why maka-provide siya definitive diagnosis if na kay TB. And the procedure is simple and it can be done by the professionals, of course. And it is economical katungod sayon ra siya, then less ang koan money, time, and effort spent. And then next, ang microscopy center kay mabutang maski maski sa remote areas. So next.
Sa DSSM or direct sputum smear microscopy, ito'y nag-serve ng one of the bases for categorizing TB cases. In order to know the standard case of tuberculosis, we can use the monitor or anti-TB treatment and to confirm the cure at the end of the treatment. There are instances that we use X-ray para makita nato ang diagnosis under sa atong lungs, pero to use the completement of bacteriological testing, pero there are instances na low specificity ang makita nato o di nato ma-differentiate kaayo unsa na disease jud ang nasa atong sa atong specific na organ na naapektuhan. And TB culture and does not differentiate the drug susceptible from drug resistant disease DSD using solid OGOA or Lewinstein Jensen or lipid media MGIT. It is a routine diagnostic test for drug-resistant disease. TB causes under the NTP. And it also used para makita nato ang prevalence of surveys sa TB, drug resistance surveillance, and search as other special cases. So nakita gyud nato na ang DSSM kay daghan gyud siya standard case, daghan siya uses para makuan gyud nato, makategorize nato ang TB cases.
Okay, so next is the tuberculin skin test or TST. So it is a basic screening tool for TB infection among children using purified protein derivative and or PPD. The tuberculin solution to trigger a delayed hypersensitivity reaction among those previously infected, and also known as the PPD test or the Mantoux test. It is one of the criteria used in determining disease activity among children. Okay, so ang TST is it is a screening to identify whether someone has had exposure to tuberculosis or It is a skin test to help diagnose tuberculosis infections in persons at increased risk of developing active disease. Pero a positive test ani does not mean nga naakay active nga tuberculosis because naatay active and inactive. And currently, the WHO endorsed available diagnostic tests in the country are expert MTB or RRF and line probe assay or LPA for the first line drugs. And the expert MTB or RIF assay is a rapid test that detects Mycobacterium tuberculosis and rifampicin resistances. So next.
So, in order for us, para makita nato ang cases sa atong tuberculosis, natin tulo ka buo, which is passive case finding, active case finding, and intensified case finding. Ang passive case finding is when asymptomatic patients are screened for disease activity upon consultation at the health facility. Ang passive case finding, muna siya ang mga individuals na nag-seek og health facility which nagpa consultation sila, nagpa-screen sila sa ilang disease through the health facility. Ang sa active case finding is a health worker purposive effort to find TB cases in the community or among those who do not consult with personal DOTS facility. Na ay mga cases na wata kabalo ang kana siya na community or ang specific community na adin siya mga tuberculosis. Na ay mga instances na ang ilang mga symptoms wata kabalo na kuan na siya tuberculosis. That is why ang mga health workers ang mangita sa purposive effort to find the cases within the community. Katong mga tao na wala nag-consult sa mga health facility. Ang intensified case finding naman is active case finding among individuals belonging to special or defined population. So, na mga specific na mga populations para makita nato yung active cases within the defined population. Ito yung mga high-risk groups, including those who consult or find themselves at the facility for other purposes. For instance, makita natin sa close contact. First is the close contact. We know na in this pandemic na we define ang close contact is we shared in a closed space or gathering man yan. So we don't know that within the gathering, may mga tao na nagkaroon ng TB and we don't know na that person has a tuberculosis and that is the transmission. For extended periods within the day with the index case during the 3 months before commencement of the current treatment episode. Next.
And the second one is the high-risk clinical groups. Okay, so these are individuals with clinical conditions that put them at risk of TB contracting disease, particularly those with immune-compromised states. Okay, so these are groups that are already having diseases which makes them at risk in contracting the TB disease. So immunocompromised or immune-compromised states are the ones that are unhealthy or that are easily to be sick. And for example, those having HIV/AIDS, diabetes, end-stage renal disease, cancer, connective tissue disease, and so on. So next.
Ang next naman is high-risk population. Those persons with high incidence of TB, particularly those in close environments or living congregate setting that promote easy disease transmission, kagaya ng inmates. Inmates is close environment yan. Kahit saan makikita mo yung mga inmates and mga elderly. May mga instances na if nagkaroon ng close environment, mga gathering, ganyan, ang elderly kasi, there are high risk talaga sa mga ganyang bagay. For example, weak immune system sila. And especially indigenous peoples, urban or rural poor. Next.
Okay, so ang TB disease na siya duha ka klase nga classification nga kanang ways nga ikaw kay mahimo kang confirm nga naa kay TB. So TB disease classification can be based on bacteriological status. So letter A is bacteriologically confirmed. So a TB patient from whom a biological specimen is positive by smear microscopy, culture, or rapid diagnostic test. So kini siya ang pasabutan ni is when you go to a clinic or kanang laboratory, then nagpa-test ka, and then from your specimen is directly positive ka with TB. So that is called bacteriologically confirmed na case. And next is
clinically diagnosed. A PTB patient or pulmonary tuberculosis patient who does not fulfill the criteria for bacteriological confirmation but has been diagnosed with active TB by clinician or other medical practitioner who has decided to give the patient a full course of TB treatment. If ang patient sa bacteriological confirmed diri sa taas, wala niya na fulfill, wala niya nakuha ang criteria bitaw sa sa iyang biological specimen, wala gyud nakuha sa smear microscopy, then ang clinical diagnosed which ang mga clinicians or other medical practitioner ang mag-decide na maghatag sa imong treatment full course unsay suitable sa imong case para ma-treat jud ka. Next.
okay. So ang next na-mention ni ka-partner Airah nga there is PTB and TB and pulmonary TB. Okay, so ganina earlier naingon namo nga there is not only pulmonary TB or kanang mo attack sa lungs and also other organs. So ang pulmonary TB or PTB refers to a case of tuberculosis involving the lung parenchyma. A patient with both pulmonary and extrapulmonary TB should be classified as a case of pulmonary TB. So timanan nato sa ato ang anatomy and physiology, pulmonary so means nga mo-attack yun na siya sa lungs nato. And next is
extrapulmonary TB or EPTB. So, nabalaan na ako na ang tuberculosis, dili lang gid na siya ga-atake sa lungs. There are instances na ang case nato sa EPTB, ang tuberculosis na involved na other than the lungs. For example, larynx, lymph nodes, abdomen, or meninges or bones or joints. So, ang kana siyang extrapulmonary TB, it is diagnosed through biopsy of appropriate sites will be considered clinical diagnosed TB. So, makita gid nato na extrapulmonary TB kimurgi na siya paano na apektuhan na gid ang atong uban organs aside sa lungs. Next.
Okay, so natay mga cases pares ra gud sa COVID. So na siya cases when you are infected. So a TB case can be classified according to history or previous treatment or management. Okay, so sa case sa TB kay it can be classified nga based sa imong history if naam na ba kay TB sa una or previous treatment nga kanang naga-treat pa ba karon or management. And then a new case is a patient who has never had treatment for TB or has taken anti-TB drugs for less than 1 month. Okay, so ang new case kay kanang, di ba ikaw healthy person and never had any TB before, and then nagka-TB ka and you will be called nga new case sa TB. And also matawag yapon ka as new case TB if naga-take kag treatment less than 1 month pa siya. And the isoniazid preventive therapy or other preventive regimens are not considered as previous one TB treatment. So ang next is the retreatment case or is a patient who has been previously treated with anti-TB drugs for at least 1 month in the past. So ang retreatment case means o sa word nga retreatment is kanang nahumana kag treatment for at least 1 month in the past nga na. So ang next is
So next nato is the DSSM results and interpretation. So ginagamit nato ang DSSM di ba as my co-reporter said. And then mo ni siya atong mga Kani siya mo ni atong mga results and interpretation. So nakita nato diri sa upper na UI TLT or International Union Against Tuberculosis and Lung Disease. And this is the scale used po sa World Health Organization. Ang DSSM, ginagamit po na siya og conventional light microscopy o fluorescent microscopy para makita nato ang EFB. Unsa man ang EFB? Acid fast bacillus. Kani siyang acid bacillus, mo ni siya type of bacteria na makita or nag-cause sa tuberculosis on certain of other infections. So, let's see the scale. Kung atong scale diri as 0, yan ang makita nato sa conventional light microscopy na there is no AFB seen in 300 oil immersion field or OIF. If magamit tag fluorescent microscopy with the 200 magnification, one length is equals to 30 fields, and 400 magnification, na one length is equal to 40 fields. If magamit ta ani, then there is no AFB observed per one length. If confirmation required po diri sa fluorescent microscopy. And then, kung magamit tag 400 magnification, there is 1 to 2 AFB per length or one length. Plus n, kung plus n ta, di ba? If mag plus n ta, then we have 1 to 9 AFB seen in 100 OIF or oil immersion field. Kung magamit tag fluorescent microscopy, then 5 to 49 AFB or one length per one length. O sa 400 magnification, then makita nato ang 324 AFB. Kung magkwanta sa 1 plus, then sa conventional light microscopy, makita nato ang 10 to 99 AFB seen in 100 OIF. And then, sa 200 magnification, makita nato sa fluorescent microscopy na 3 to 24 AFB. Pero sa 400 magnification, makita nato ang 1 to 6 AFB. Sa 2 plus, makita po nato sa conventional light, if magamit na conventional light, makita nato ang 1 to 10 AFB or OIF in at least 50 fields. And then, if 200 magnification ta, nakita nato ang 25 to 250 in one field. And then, sa 400 magnification, dili pod makita nato ang 7 to 61 field. And lastly, sa 3 plus, makita nato ang greater than 10 AFB or OIF in at least 20 fields sa conventional light. And lastly, sa fluorescence microscopy, kung magamit tag 200 magnification, makita nato ang greater 250 per one field, and then sa 400 magnification is 61 field. So I will delete it. So case holding is a set of procedures which ensure that patients complete their treatment. So make sure nila na ang patient nag-follow gid siya sa procedure, giset na procedure, depende sa ilang kind of disease or type sa ilang disease. Depende po sa kanilang treatment. While effective anti-TB drugs are available in the country, there are still many TB patients who are not cured because they stop taking anti-TB drugs or take them irregularly. Nay mga tao po na maka-afford po sa TB drugs, na po yung ubang tao na dili gyud maka-afford sa sa TB drugs. Sa atong medication, not drugs gyud na kuan ha. Kanang medication na siya. If dili gyud na ma-take ang mga treatment or TB drugs, anti-TB drugs, then it may lead to chronic infectious illness, drug resistance, or death. And the best way to prevent the occurrence of these events is through regular intake of appropriate drugs for this prescribed duration. So, kailangan dyan na to mo take og TB drugs para dili na gid na mabektuhan ng atong ubang tao na magkaroon po sila tuberculosis. And through the case holding, it involves assignment of the appropriate treatment regimen based sa ilang diagnosed o previous history of treatment, and supervise drug intake with support to patients and monitoring responses to treatment through follow-up sputum smear microscopy. Dili lang taong pataka og diagnose hatag og tambal sa usa ka tawo, dapat makabalo sa ilang history wa kabalo before nagka-TB na sila in na disease ti eye. So that's the case holding. Next. So direct observed treatment or DOT. Kani siya na method. It is developed to ensure treatment compliance by providing constant and motivational supervision of TB patients. So kani siya na DOT, kani siya na method, dapat yun ni siya i-apply especially sa tanang TB patients. Kanang gid siya kay ma-motivate ang usa ka pasyente or pasyente kung naay tao na magkuan sa iya mo tabang sa iyang treatment na para constant yun ang paghatag sa iyang treatment sa usa ka patient through sa atong mga workers. And DOT workers, by having a responsible person referred to as a treatment partner, watch the TB patient take anti-TB drugs every day during the whole course of treatment. Kaya na may instances na usa ka patient di na siya mag-take og tambal, so with this method, makatabang din siya para maayo ang isa ka TB patient. Okay? Next.
Okay, so daghan kaayo nga patients, treatments, of observations, no? Okay, so dungagan pa jud na nato. So let's go back sa atong TB nga mga registration groups. Okay, so ang first registration group, di ba natay new case and also retreatment case. Okay, so ang new case is a patient who has never had treatment for TB or has taken anti-TB drugs for less than 1 month. So mao na katong ingon na ko, if never pa ka nagka-TB, then nagka-TB ka, kay mao nang new case and or na kay TB pero naga-take pa kag anti-TB drugs for less than 1 month. Si manina ha, less than 1 month. Okay, so ang next is relapse, treatment after failure, treatment after loss to follow-up, and previous treatment outcome unknown. So these ones, kini sila, kay considered as retreatment case na sila, pero daghan jud kayo klase nga retreatment case para jud makabalo ta kung unsa na siya nga klase nga retreatment case. Dili lang kay kung basta kini nga 1 month humana ka ana, mauna na retreatment case na ka. So daghan jud na klase-klase. So first is the relapse. So it is a patient who previously treated for TB and who has been declared cured or treatment completed in their most recent treatment episode and is presently diagnosed with bacteriologically confirmed or clinically diagnosed TB. Okay, so dili tanan TB nga kana mawad-an na kag TB gani kana ma-cure na ka, that doesn't mean nga dili na siya nga case. So it is also a relapse case nga kanang na declared na ka-cured or treatment complete. So that is what you call a treatment relapse nga case or group. And the next is treatment after failure. So literal jud kayo ni siya nga kuan nga after treatment na ay failure or during the treatment there are no significant nga kanang improvement sa imuhang health. So a patient who has been previously treated for TB and whose treatment failed at the end of the most recent course. Okay, so mauna na ha. And this includes letter A patient whose sputum smear or culture is positive at 5 months or later during the treatment. Okay, so natay kuan nga kanang na cured na ka. Pero after 5 months di ay pagpa-treat ni mo otro or pagpa-check up ni mo otro is positive pa di ay ka. So that is what we call treatment after failure. So ni asara ka nga cure pa ka. And next is letter B is a clinically diagnosed patient for whom sputum examination cannot be done and who's not show clinical improvement any time during the treatment. So mo ingon na ko nga during treatment wala kay improvement sa imong health and most not most cases but there are cases nga kanang mas ni degrade pa imong health during the treatment. And so move on ta sa treatment after loss to follow up, so TALF. So it is a patient who was previously treated for TB but was lost to follow up for 2 months or more in the recent course of treatment and is currently diagnosed with either bacteriologically confirmed or clinically diagnosed TB. So, literal po ni siya nga lost to follow-up nga treatment. Napa-treatment ka, pero na-lost ka sa follow-up or wala na ka nag-check sa imong self if continue pa ba ang treatment or kana or nawala ra kag kalit. Nga na mao na siya ang treatment after lost to follow-up. And the next is the previous treatment outcome unknown or PTUO are patients who have been previously treated for TB but whose outcomes after their most recent course of treatment are unknown or undocumented. So dili jud tanan perfect nga naa jud permanente and or kanang definitive jud kaayo ang results kay there are treatments nga kanang ang outcome di ay sa imong recent course is unknown or kanang undocumented siya. And next is the others kay patients who do not fit into any categories listed above. So kining naay about sa taas kining new and retreatment cases groups kay naa jud nay instances nga wala jud dito ang category niya nga naa dito. So that is why naa siya sa other. So next. Okay, so ang next is there are two types of drug treatments for TB. So naingon to ganina ni Airah nga there are different drugs nga pwede nimo ma-take and also bawal nimo ma-take or kanang i-take nimo regularly kay na siya doses. Okay, so ang first type of drug treatment is the fixed dose combination or FDCS. Okay, as the name suggests, combination. So combined ni siya nga mga drugs and also fixed na daan ni siya kay dili ni siya kanang kini kailangan nimo tas kini kailangan dili ka na magbuot-buot kitong fixed na ni siya. Okay, so these are two or more first line anti-TB drugs are combined into one tablet. And there are 2, 3 or 4 drug fixed dose combinations. Okay, so ang combinations dili lang siya kay tungod duha lang ka kuan, dira ra jud na duha ra jud na ka combination nga tambal. So naatay mga duha ka tambal, tulo or upat nga drugs nga gi-fixed combine sa isa ka dose or sa isa ka tablet. So namely, isoniazid rifampicin or HR. Next is the isoniazid rifampicin ethambutol or HRE. And the next is the isoniazid rifampicin pyrazinamide ethambutol or HRZE. So these are usually provided in kits with boxes of blister packs corresponding to treatment phases of an average weight patient. So kini siya, nanatay ko nga kanang i-provide ni siya nga na siya sa kit or box na daan nga nakabutan na lang dito ang imong mga tambal. And natay keyword diri nga average weight patient. So mag-wait lang sa taana kay later on ma-discuss na to ang anong included man jud ang weight sa isa ka patient in treatment. So ang next is
ang single drug formulation or tinawag na to STF. Each drug is prepared individually either as tablet, capsule, syrup, injectable, streptomycin form. Ang anti-TB treatment regimen shall be based on anatomical site and bacteriological status, including drug resistance and history of prior treatment. Ang sa single drug formulation, na yung mga drugs na either tablet siya or capsule, injectable siya, or syrup na nakakuha na siya. Depende sa formation. Tablet ba siya, ang atong streptomycin. And na yung mga cases na depende man na sa atong case kung atong tuberculosis kung napektuhan bang atong lain parts sa atong organ. So nag-base yun na sa atong anatomical site na apektuhan ng imong tuberculosis. And that is mga magpili depende sa imong case kung gid ka suitable either tablet ba ka, capsule, syrup or injectable. And except in cases of adverse drug reaction and special circumstances and requiring treatment modification. And TB under the NTP, say na NTP. NTP is National Tuberculosis Control Program that shall confirm to its standards regimens. Yes. Next. So, wait lang. So kani mo niya ang mga recommended treatment for regimen sa mga adults and children. Kita natin na categorize ang atong treatment depende sa unsa atong classification sa atong TB. Either lala na ba na siya or unsa pa. So first, we have category 1. Ang category 1, kung na-classified ka na pulmonary TB or new whether through bacteriological confirmed or clinical diagnosed pa ka, then naapod tayo classification na extrapulmonary TB whether through biological and clinical diagnosed except CNS or central nervous system, bones or joints. So tagaan kay treatment na 2-HRZE or FHR. So mabalaan po nato unya later on ang mga drug na dosage na ginagamit po sa mga recommended para sa mga adults and children. And kung category 1A ka, then ang kung na-classified ka na category 1A ka if you have extrapulmonary TB which new CNS and bones na nadamay. Katong sa category 1, wala nadamay ang CNS. Na-categorize na ka na 1A is nadamay na imong CNS, bones, and joints. And then, tagaan na yung treatment na 2-HRZE or 10-HR. Next, Daxx.
So, ang category 2, okay ni, is pulmonary or extrapulmonary previously treated drug susceptible TB. So, mao na imo ang classification group. So, it could be relapse, treatment after failure, treatment after loss to follow up, previous treatment outcome unknown, or other. So, kini siya retreatment cases na ni siya ang tawag. So, mao na siya 2-HRZES, HRZE, or HRE, ang treatment regimen niya. Next is the category 2A. So, you are classified and registered in a group na pulmonary or extrapulmonary previously treated drug susceptible TB. Di ba kabalo naman kung saan pulmonary or extrapulmonary, no? So it is whether and next is whether bacteriologically confirmed ka or clinically diagnosed. So mao na siya nga category 2A. So ang treatment ni mo nga regimen is the 2 ka HRZS, 1 HRZE, and 9-HRE. And next is the standard regimen drug resistant or SRDR is kay rifampicin resistant TB or multi-drug resistant TB. Mo ni siya ang classified ka nga kini SRDR if rifampicin resistant TB ni siya or multi-drug resistant. So natay TB nga kung sa siya kahusgon nga na siya kakayahan nga mo resist sa isa katambal. So ang treatment ani is individualized once the DST result is available. And then treatment duration for at least 18 months. So dugay-dugay dyan siya nga treatment. And the next is the XDR TB regimen or the extensively drug-resistant TB. Kini kay pinaka-strong na dyan siya nga type of TB nga kanang extensively drug-resistant yun siya. So ang imong treatment regimen ani is individualized based on DST result and history previous treatment. So mag-base na sila sa ilang conclusion kung sa ilang ibutang sa imuha. Okay, so next.
Okay, so na-identify na nato ang recommendation na treatment para sa mga regimens sa adults and childs. So, karon mag-discuss ta sa drug dosage per kilogram body weight sa adults and children. So depende ba na sa sa atong status kung adult pa ka or children, then naay mga specific na mga milligram na ihatag sa imuha. So mo ni ang HRZE or katong giingon na mo ganiha na mga treatment regimen. Mo ni siya ang isoniazid, rifampicin, parazinamide, ethambutol, and streptomycin. If ang adult, tagaan siya drug na isoniazid, then dapat 5 ra na siya and either 4 to 6 milligram depende sa imong kilo as an adult and does not exceed to 400 milligram daily. Same gapon sa child, kung sa children, 10 to 15 milligram depende sa imong kilo and not exceed 300 milligram daily. Sa rifampicin naman sabta, if ang imong kung adult ka, 8 to 12 milligram per kilo and not exceed 600 milligram daily. And sa children, 10 to 20 milligram depende sa imong kilo and not exceed to 600 milligram daily. Ang pyrazinamide, 20 to 30 milligram per kilo depende sa imong kilogram and not to exceed 1.2 gram daily. And kung sa children ta, 20 to 40 milligram per kilogram and do not exceed to 1 gram daily. And sa ethambutol, mo ni siya ang atong milligram which is 15 to 20 milligram per kilo and not exceed 1.2 gram daily. Dili kilo nga nang sa kwan ha. Kanang kilogram depende sa imong weight. And then, ang atong sa children, 15 to 25 milligram per kilogram not to exceed 1 gram daily. Ang streptomycin, 12 to 18 milligram per kilogram not to exceed 1 gram daily kung adult ka. And lastly, 20 to 40 milligram per kilogram not exceed to 1 gram daily. So, kani siya na drugs dosage, kani sila, muna siya ang mga first line treatment sa tuberculosis. And kaning streptomycin, muna siya ang antibiotic medication used to treat bacterial infectious diseases, including tuberculosis, TB. So, what siya next?
Okay, so many TB patients would usually discontinue treatment either because they felt that they have already been cured due to absences of symptoms or because of the adverse drug reactions that they experience. Okay, so dili tanan drugs kay positive jud ang effect kay just like me, na ako'y certain nga mga drugs nga makakos ng allergy. Nga na, sa mga allergy unon dira, kabalo jud ta ana. And also, ang mga TB patients, pwede na siya nga would usually discontinue treatment kay tungod feel niya wala na siya TB kay there are no symptoms nga nang kawas and or kanana sila adverse reactions sa mga drugs. So treatment partners must know how to manage this, especially the latter. Okay, so ang next is sa table diri kay natay adverse reactions. The drugs probably responsible, and also the management. Okay, so natay adverse reactions kung mag-take ta sa drugs, kay dili jud na mawala nga natay reactions. And napo tay drugs na responsible ato nga reactions, and also napo tay drugs nga i-manage or ipanglaban ato nga reaction. Okay, so ang first is the gastrointestinal intolerance or kanang naglain nimong pamati sa tiyan, yan na. So ang drugs probably responsible kanang may nag-cause nga na is the rifampicin, the isoniazid, and also the pyrazinamide. And the management or ang drugs nga ihatag sa imo ana para i-manage to siya nga imuhang na react is give drugs at bedtime or with small meals. So dili na siya kanang naay drugs ihatag sa imo or kundi kanang i-give ni siya nga drug during bedtime or after small meals. And next is the mild or localized skin reactions. So para ni siya sa uban nga tao nga kung na sila i-take na drugs kay magkatul-katul, nga na mapula-pula. So it could be any kind of drugs. So ang ihatag ani niya is the antihistamine kay para ma-relieve ang itchiness, nga na runny nose, sneezing, or watery eyes. Kay ang histamine, mao na siya makakos sa mga allergic reactions, di bale. And so number 4 is the orange or red colored urine. So kulbaan jud ta ani kay basi magputag UTI nga na, pero these are caused by the rifampicin drug kini. Pero in most cases kay sa mga kini nga tambal kay tungod nag-treat kani sa anti-TB drugs. Okay, so ang management ana is to apply is to reassure the patient. Ayan na. So number 5 is the pain at the injection site. So di ba natay drugs nga tablets, syrup, or injectables nga naingon ni partner Airah. So na dyan na instances nga magsakit jud atong kuan ka nag-injectionan para sa COVID gani, di ba naman dyan sakit to sa tas dugay mo wala. So ang probably responsible ana nga drug is the streptomycin, and wala na ilain ani nga management kundi ang apply warm compress dito ang site.
So, sunod na po, ang atong adverse reaction mo ni ang burning sensation in the feet due to peripheral neuropathy. Kanang peripheral neuropathy mo na siya ang result sa damage sa to gawa sa atong nerves na makitaan sa gawa sa atong spinal cord and brain. And then, if nagkaroon ka ng mga reaction na ani, then possible tagaan ka drugs na isoniazid or isoniazide. And how to manage? Kung para mag-manage na to, tagaan na to o give pyridoxine, vitamin B6, 500 to 100 mg for treatment and 10 mg daily for prevention. Ang atralagya due to hyperuricemia, muna siya kani siya na disease, kani siya na adverse reaction, muna siya costly sa mga females na sa atong joints bitaw na mga causes sa atong joints na intermittent hand joint. Yes. And then kung para makuha na tong mga atong adverse reaction ani, responsible para atong ikuan atong tamba, which we have the pyrazinamide. And to manage, give non-steroidal anti-inflammatory drugs or NSAIDs. If symptoms persist, consider gout and request for blood chemistry. And lastly, kung natagka-adverse reaction ta sa flu-like symptoms, mga fever, muscle pains, inflammation of the respiratory tract, then drugs na gihatag sa imuha is rifampicin. And to manage, give antipyretics. Okay.
Okay, so kato sila na mga adverse nga effects is only minor. So next is ang major effects. So ang first is kung ang iyahang reaction is severe skin rash due to hypersensitivity. So natay mga tao nga hypersensitive jud kaayo. And it is because of any kind of drugs, especially streptomycin. So ang immediate na management or response dapat ani is to discontinue anti-TB drugs and refer to appropriate specialist dayon. And next is the jaundice due to hepatitis. And it is caused by any kind of drugs gihapon, pero especially nga isoniazid, rifampicin, and also pyrazinamide. And then number 3 is the impairment of visual and color vision due to optic neuritis. Cool ba jud kay mga cause sa isa katambal no, kay it could be major kay napod ay nga kana mga visual impaired na dayon ka after na. So ang major cause ni is the ethambutol. Ang management gyapon ani is to discontinue the anti-TB drugs and refer to appropriate na specialist. And then number 4 is hearing impairment, ringing of the ear, and dizziness due to damage of the 8th cranial nerve. So ang kining major nga tambal ang nakakause is the streptomycin ani. Pero dili jud ni siya ingon nga kung mag-take ka ni makainganan rin ka, it could be possible lang siya nga mag-react sa imuha. So napod kay ear impairment or kanang nagani mag-ring perminti sa imong ears, nakatry na tana sukad. Okay, and number 5 is the oliguria or the albuminuria due to renal disorder. So streptomycin or rifampicin ang cause ani. Then ang next kay mao ni siya ang to discontinue the anti-TB drugs if na kay ato nga reaction. Number 6.
Okay, ang number 6 kay psychosis and convulsion. Ang psychosis, muna siya ang mga tao na people, mga na psychological factors na mga tao na with some lose contact with the reality. And then, muna siya, tagaan nato siya og tambal na isoniazid. And kani siya, atong management ani discontinue to anti-TB drugs and refer to appropriate specialists, especially ang isoniazid na tambal. And lastly, thrombocytopenia, anemia siya. Ang thrombocytopenia, muna siya ang mga loss of platelets, especially sa bone marrow, muna makakause of leukemia. And then, kabalo to, anemia, loss of RBC. Then, kung tagaan ka o para makuha ang drug retreatment mo ani, then tagaan ka o rifampicin. And the management is to continue anti-TB drugs and refer to appropriate specialists. So, kailangan na get to specialista.
Okay, so growing consensus indicates that the progress in tuberculosis control in the low and middle income world will require not only investment in strengthening tuberculosis control programs, diagnostics, and treatment, but also action on the social determinants of tuberculosis. So natay consensus ani if mo-grow gyapon consensus sa TB. So magdapat ang government na jud mismo ang mag-invest into strengthening the control programs sa kuan sa isa ka country. And then, however, practical ideas for action are scarcer than is national support for this idea. Interventions from outside the health sector, specifically in social protection and urban planning, have the potential to strengthen tuberculosis control. So, ang practical ideas na i-action or implement ay much scarcer siya or much less, mas kulang siya compared sa support jud kay sa government. So interventions from outside the health sector kay kailangan jud na siya is to strengthen ang ato ang tuberculosis control programs. Next.
So next is ang ingon ni Hargreaves et al. 2011 mentioned that key structural determinants of TB epidemiology includes global socioeconomic inequalities, high levels of population mobility, and rapid urbanization and population growth. As our world expand, na kind of mga tao, na mga instances, di ba, magkaroon ng TB ang patients. And through these conditions, it gives rise to inequality distribution of key social determinants of TB, including food insecurity, malnutrition, poor housing environment conditions, and financial, geographic, and cultural barriers to health care access. So makita nato ang mga tungod sa TB epidemiology, natin mga social economic inequalities mo tong may mga instances na di kitagaan taga unequal distribution ta. May mga places na dili gid matagaan og care, may mga tao na dili matagaan og proper treatment sa ilang disease, especially ang tuberculosis. And in turn, the population distribution of TB reflects the distribution of the social determinants which influence the 4 stages of TB pathogenesis, which are exposure to infection, progression to disease, late or inappropriate diagnosis and treatment, and poor treatment adherence. So mo ito sila ang upat ka stages na reflect sa mga tungod sa population distribution, mo ito nag-reflect sa social determinants, mo ito nag-determine sa atong population distribution, nag-reflect siya sa atong case, sa atong social.
Lastly, ang TB illness further exacerbates poverty, food insecurity, and malnutrition. So, ang TB illness kay much worse pa niya ang poverty, ang food insecurity, and also malnutrition sa people. And then, alleviating the poverty and improving the food security of these impoverished populations may reduce their TB burden or kanang i-make less ang severity ng poverty by improving the food security and of these populations kay na siya chance nga maka-reduce sa ilahang TB burden. So ang next, okay, so humanata sa ato ang discussion, and so we have already discussed what is TB, what caused TB, and what are the patient classifications of TB or groups, and also what are the treatments to be done, and also the other parts. And the reporters will leave you a short message.
If symptoms persist, consult your doctor. This has been Airah Bruno
and Daxx Kenu Bugtai.
Thank you for listening.